Hello, everybody, and thank you for joining me today on this presentation about the revolution in digital healthcare that has really come to fruition over the course of the latter half of 2020 and now 2021. We're seeing a significant increase in the usage of telemedicine, remote patient monitoring and management, and electronic health records because of the need for healthcare services to be delivered in a way that is completely new and in a way that is completely necessary to so many people who have never before used these sorts of services, and by physicians and nurses and pharmacists and other ancillary clinicians who have never used them as well. So we're looking at a true revolution in healthcare through digital transformation in ways that we've just never seen before. So today's presentation and today's lesson will be focused on, first of all, identifying and defining what digital healthcare is and what digital in healthcare means, and then walking through some case studies of digital in healthcare and what that means to people around the world. And then also really paying very close attention to whether or not organizations are being built and being structured in ways to respond to this urgent need to move into a virtual healthcare setting where oftentimes now healthcare services are being delivered virtually to patients around the world. And that really is the cornerstone of this presentation today. My name is Stan Kachnowski. I'm the director of the Digital Health Program at Columbia Business School in the Executive Education Department. I'm also chair of the Healthcare Innovation Technology Lab, also known as HIT Lab, a leading digital health efficacy testing lab based out of New York City. And my goal here today is to ensure that you walk away with some very key lessons in digital health. First of all, I want to make sure that you understand the definition of digital health and the use of digital health technologies across the healthcare ecosystem. Number two, I want to ensure that you take away some insights into how major digital health stakeholders and major stakeholders in the global healthcare system are using emerging digital tools at an unprecedented pace, particularly with the pandemic and the endemic. And then thirdly, provide some guidance on how to apply these terms, these technologies, and these techniques to leverage this rapidly evolving field in your organization. First of all, let's look at the two components that make up digital healthcare today. The first component is known as bioinformatics, and bioinformatics or systems biology is really defined as any data that is coming from the human body. So if you think about the data that your human body produces today, it could be in the form of DNA sequencing from your hair. It could be blood tests. It could be things like skin samples. It could be certainly some of the saliva that people are using these days for COVID testing. So bioinformatics is a crucial part of digital health and its ecosystem because it really does contain extraordinarily objective biomarkers from the human body that are able to tell physicians and other clinicians, as well as researchers and scientists, what's happening digitally from the human body. The next component of digital healthcare really falls into this term called biomedical informatics. And biomedical informatics has been a field, much like bioinformatics, that's been around for well over 50 years. It is a discipline amongst most top medical schools in the world, just like bioinformatics. And the biomedical informatics is defined as data that is being generated from sources around the human body. And so what does that mean? Biomedical informatics would include your electronic healthcare record data. It would include a telemedicine visit. It would include apps and wearables and Internet of Things like your refrigerator that might be tracking how much Ben and Jerry's ice cream you're eating at night. It could be things like Alexa, your voice skill. It could be the websites that you visit to collect your health information. It certainly is remote patient monitoring and these sorts of technologies that we're using nowadays because of the pandemic much more often than ever before. It would also be things like analytics and data visualization. So anything that collects, stores, or captures, visualizes, or analyzes data is biomedical informatics as well. And so what happens in digital health and why is this a unique term? Because when we start thinking about combining both bioinformatics and biomedical informatics, we create this new digital human, and that is absolutely critical to understand. It was something that was developed in the early 2010s as a new framework for identifying how patients can be treated, not just as an individual patient, but how populations of patients can be treated more efficaciously, how we can bring more effective interventions to treat patient populations on whole. And that's why the term digital health, often also called digital medicine, has been forthcoming and so important to changing how we think about healthcare in the world today, globally, not just in any one country. And these sorts of terms that you see in this word cloud, whether it's medical record systems, personalized healthcare, patient centricity, telemedicine, any kinds of interoperability, it's really critical to think about this as disease management, to think about this as population health, and then continuing to build these technologies so that they help all 8 billion people on the planet, so that we start talking about the social determinants of healthcare and understanding what's driving the healthcare outcomes for all 8 billion people and how digital can play a role in that process. And so, to put it into an equation, ultimately, digital health is defined as anything in or about human healthcare that can be turned into data, whether it's from the human body or whether it's around the human body. So it could be, again, your tissue, your skin, your saliva, your blood, things like that, as well as your wearable, your whether it's an Apple Watch or a Fitbit or a Samsung or a Pixel, or it could be your Alexa, your Siri, your Google Voice that's interacting with the patient as well. And ultimately, we get digital human and we get digital human populations, which are extremely important, particularly in the ecosystem today with the amount of data that's being collected and analyzed around the pandemic. To give you some idea of what we talk about and what we mean with this, it's important that we can begin to talk about these 12 vectors. And really, part of the research I've done in my 30-year career has been to study how each one of these vectors intersects with various major diagnostic categories, major therapeutic areas, including things like diabetes or heart disease or cancer, or certainly mental health, and obviously infectious disease and many other areas. And so when we begin to look at these 12 vectors of digital healthcare, we begin to see that they have very specific and very important annotations and applications that we can look at as really, really strong case studies for how to apply these digital technologies with certain techniques to ensure their success. And so, for instance, let's take a look at wearables and biosensing. And wearables and biosensing have been very popular over the last 5 years. If you don't know about the Apple Watch, so in my office I have digital technologies everywhere, but wearables could be an Apple Watch, it could be a chest patch for picking up your heartbeat and a clinical indicated EKG, ECG through remote telemetry, particularly for AFib and DFib patients. There are a number of other wearables these days that people are utilizing for even things like concussions and seizures, and a number of other therapeutic areas that are being applied. And now we're seeing things like insulin, blood sugar, and other types of digital technologies that are wearable to really help diabetes patients on a day-to-day basis lead and optimize their daily living. And so when we think about wearables and we think about how popular they've become over the last 5 years, and then we think about the application of some of these during a pandemic, it becomes very clear that their growth is not only heavily warranted, but in today's pandemic world where we're trying to maintain some sort of distance for a lot of patients in their homes, particularly older adults, et cetera, we're looking at an opportunity now where wearables have become much more popular. So really, more in the single digit adoption rates, now into the mid adoption rates, the mid double digits adoption rates. And so something like a wearable and how much more important it's become in the healthcare system, so that older adults are able to use wearables at home to monitor what they're doing, how they're doing, whether it's an activity tracker, whether it's a fall sensor, whether it's a pulse oximeter at the end of their finger. These are the sorts of wearables now that we've seen grow from, more of a hobbyist kind of single digit penetration into the ecosystem into now much more of a double digit adoption rate within the ecosystem. The other thing to think about too is really analytics and data analysis. And when people think about digital health, they certainly understand the population health ramifications of now we have all of this data. One thing that's really important to remember is 80% of the world's data has been generated over the last 2 years because of the pandemic. That's a massive number. And when you think about 80% of that data, we also think about roughly a third of that data is healthcare data. And that's stunning when you start to think about it. It's not surprising from a healthcare standpoint. As a healthcare professional, we look at the amount of data being generated by patients, and they would become fairly clear. It is not stunning that we would have all of this data generated by healthcare. But the analytics and the big data opportunities now in the ecosystem are incredible. And we're seeing better and better data analysis being done on populations to identify which populations are responding to which COVID treatments better, which populations are needing more mental health resources, which populations have gained the most weight during a pandemic, things like that. And so now we're able to take the data that are being derived from all of these digital health technologies and really begin to target better healthcare interventions for these populations. And so really the idea is that digital is not only informing what we're doing as healthcare professions and as physicians, as population health specialists, as public health officials and professionals, but it's also now helping us identify as well as intervene. So now using digital, we can better target population health measures as well as individual patient measures for helping patients get better. Not only get better in terms of the mental health attributes that they're facing with increased anxiety, increased depression, increased sedentary behavior and stress. So there are now a number of different digital health interventions around helping people exercise more, helping them receive more mental health interventions at the home through their apps and telemedicine technologies, and a number of other ways. And so these sorts of data analytics aspects within that one singular vector are really important to understand. And so as you continue to walk through the 12 vectors of digital health, we begin to see that they are truly touching patients all throughout the ecosystem today, which is not to say very important. I mean, it's hard to really underestimate and understate, if you will, how important it is to have this wealth of technology, not just in North America or Central America or South America, but all over the world to help patients respond with these sorts of technologies. And one of the things I wanted to do today as well is to provide some business cases, if you will, of where digital health technologies, and some of these are still emerging, some of these are well into the ecosystem, have played major roles. And we're seeing significant adoption rates of these technologies in different populations all over the world. And I wanted to show a realm across not just wearables or apps, but some other areas as well. So if you look at the upper left-hand corner of your screen, you'll see Halo and what was released in early 2021. The Halo, the Amazon Halo wearable, as well as the Amazon Halo app, and you'll see that it has a number of different ways of being able to track human data and human biological data, which is critical. It's absolutely important for the patient today to be able to have a better understanding about what's going on within their not just their activity, but oftentimes their sleep or lack of activity. It's important that they're getting a good night's sleep. And so Samsung and certainly the Apple Watch, which is and Fitbit, which are both very similar. And incredible ecosystems. And taking a look at the Apple Watch as an ecosystem, it really is the leader in this area, given Apple's commitment to healthcare going back now, really since the beginning and the launch of the Apple Watch in 2012, and the fact that they have, over the last nearly 10 years now, invested enormous sums of funding into improving the Apple Watch capability on a number of levels. So whether it's activity, whether it's sleep, whether it's stress, and certainly heartbeats, and now growing into this field of being able to have a clinical EKG, ECG coming off of an Apple Watch. It is an incredible device, and remember, it's not just a healthcare device. Apple Watch is a platform for phone calls, text messaging. It's a platform for stock quotes and sports scores, and hundreds of other apps are sitting on someone's wrist, and making it a viable platform that has significant value. And again, patients like that. Patients like to have a technology that's not just about their healthcare. It's about a lot of other things. And oh, by the way, it has healthcare there as well. And if you look at the middle of your screen, you'll see a chart with a bunch of green and red dots, and you'll see a phone with an app and a medication packet that is enabled with a near field communications signal, so that patients who are taking medications in clinical trials can let their clinical trial physician and investigator know that they're on course taking their medications at the right times. Why is that important? That is absolutely critical, because patients in clinical trials, it is absolutely essential that they follow certain dose, timing, and frequency protocols to ensure that the medication is being taken in a proper way, so that future patients, once the medication is being used by millions around the world, will have been told that their medication is working correctly because the clinical trials patients also used it correctly. So this technology by Information Media Corporation is, now that the supply chain has been so virtualized in pharmaceutical and life sciences, has now become a cornerstone of the digital health ecosystem. And so that sort of intelligent medication platform is absolutely critical as a part of the digital health ecosystem, as clinical trials have virtualized around the world as well. Another device that is a digital health device is what you see in the upper right-hand corner, something called OneDrop, which is a wireless glucometer that was put together in a very, very affordable fashion for patients with diabetes, so that they're able to pay a subscription fee once a year for roughly a little over $100 and receive not only a very fancy, very polished, very gorgeous glucometer, but also an app that goes with it that they can use with their phone to track their blood sugar readings. And as a part of their subscription, each year for a little over $100, they're able to get unlimited test strips, which is very much a novel and transformational mechanism. So this company, OneDrop, and its technology set has seen rapid growth throughout the US ecosystem as a business to consumer, a direct to consumer offering, which is highly unusual in most ecosystems, since patients typically are not accustomed to paying out of pocket. But again, part of this digital health revolution has been this new element of consumer-driven healthcare that has been around for a long time. The term consumer-driven healthcare is not new, but in terms of its activation, going from single digits to now double digits, where consumers are willing to pay a little bit more for virtual doctor's visit. They're willing to pay a little bit more for an absolutely gorgeous diabetes technology and app for their blood sugar, and they're willing to pay out of pocket. So that's part of what we've seen within this digital health revolution over the last 2 years. And mind you, digital health has been around for a long time. Even before the term existed, biomedical informatics and bioinformatics existed for many decades. But this idea of digital health combining biomedical informatics and bioinformatics together to target more personalized healthcare, that's a newer phenomenon. And that construct of the digital human is a newer phenomenon. And it allows doctors and public health professionals to target patients and populations more accurately with interventions. So that is new. And seeing this increase in business, an increase in success for companies like OneDrop and Information Mediary, and certainly Apple and Fitbit, we've seen those technologies also selling more, becoming more popular because people are more focused now on their health during the pandemic. So very interesting trends, and certainly I don't use the word revolution haphazardly. It's been used a lot over my career since I've been teaching and researching over 30 years now, starting in 1991. I've heard this term revolution used many times, but it is really now when, and maybe during the dot-com era from 96 to 99 to 2000, something like that, where revolution could be properly used and would actually mean something and was in fact a real phenomenon because of the rapid adoption of technologies that previously had not seen such high usage before. And so those are some examples of digital health. And let's talk a little bit more about why this is important today. Why is everyone talking about the digital health revolution? Really, the primary reason is disruption. And we're seeing disruption not only caused by a pandemic and the virtualization of healthcare, but also we're seeing disruption by the virtualization of entire ecosystems like clinical trials, like patient delivery and patient care, like drug delivery and things like that. So one of the reasons that everyone wants and needs to begin to transform their organizations rapidly are case studies like BlackBerry, or like in the United States, this video chain called Blockbuster, where they were not able to transform fast enough, and they didn't have a patent that Netflix did have it for monthly subscription rentals. And so that idea of transformation today is more important than ever. And whenever there's a revolution, there's a lot of change on a macro societal, macroeconomic level. And this kind of preparation is key for you to understand and for your organization to understand, whether you are a hospital, whether you're a health system, or whether you're a life science company or an employer. All of these macroeconomic and macro technical changes are going to drastically affect your business models. And it's important to understand, again, the terminologies, the technologies, and the techniques required to be successful in these areas. My name is Stan Kachnowski. I'm the director of the digital health program at Columbia Business School, and I greatly appreciate your time today. Thank you for watching this program. I hope you did learn those 3 key learnings around digital health today and some of the insights and some of the techniques and technologies. Please contact me if you have any questions around my program or any questions and any collaborations around research and or teaching. It would be great to work with you, and hoping that you do stay safe amongst this difficult time, and wish you all the best. Take care.